Good morning. My name is Dr. Mary Stephen. Welcome to the WHO Africa media briefing. Ahead of the Africa Vaccination Week, we are going to be talking about how to revamp routine immunization, as well as the COVID-19 vaccination disruption that COVID-19 vaccination that it has disrupted vaccinations during the pandemic. Before we go to the main presser, we will have some housekeeping. First, you can listen to the presser in either English or French. To do this, please use the interpretation button at the bottom right-hand corner of your screen. Just click on it and select your most preferred language. And joining us today from Brazzaville is Dr. Joseph Kabore. He's our Director of Program Management. Dr. Joseph Kabore is going to introduce our panelists for today. Good morning and welcome, Dr. Kabore.
Good morning, Mary.
Pour les personnes qui suivent la conférence de presse qui sont francophones, vous pouvez sélectionner le langage dans lequel vous allez suivre cette conférence de presse et bénéficier de services d'interprétation en cliquant sur le globe qui se trouve en bas à droite de votre écran et en sélectionnant votre langage préféré.
So thank you very much, Mary. Good day, ladies and gentlemen of the media, and welcome and happy African Vaccination and World Immunization Week to everyone. I bring you warm greetings from Dr. Moiti, the WHO Regional Director for Africa, who unfortunately is unable to be with us today. With regard to the press conference this morning, I have the great pleasure of introducing our distinguished guest. First is His Excellency Dr. Austin Dembi, Minister of Health, Republic of Sierra Leone. Thank you so much, Your Excellency, for joining this media briefing this morning. Second is Dr. Franklin Asiedu Bekoe, is the Director of Public Health, Ghana Health Services. Thank you very much, Dr. Asiedu Bekoe. And the third one is Ms. Aurelia Nguyen. She's the Chief Program Strategy Officer at Gavi, the Vaccine Alliance. Thank you for joining the briefing. And the fourth guest is Professor William Ampofo, Secretary of the Presidential Committee on Vaccine Manufacturing and Development in Ghana. Thank you, Professor. As you may all be aware, every year, the life-saving power of vaccines is celebrated during World Immunization Week, which is held during the last week of April. Over the last 2 decades, Africa registered tremendous progress in improving access to immunization services. But despite this progress, about 30 million children in Africa are estimated to suffer from vaccine-preventable diseases each year. In February 2023, African head of states and governments on the sidelines of the 36th ordinary session of the African Union Assembly declared their strong commitment to increase investment in African immunization programs. And the government of the Republic of Sierra Leone, the African Union Commission for Health, Humanitarian Affairs and Social Welfare, and the World Health Organization organized the event. We are very grateful for the strong political support and commitment of our leaders. at a time when immunization programs in our region are experiencing the negative impact of the COVID-19 pandemic. For instance, the number of children who have never received a single dose of vaccine, called zero-dose children, increased from 7.7 million in 2020 to 12 million in 2022. It's therefore not surprising that in 2023, 31 African countries experienced an outbreak of vaccine-preventable diseases. We commend the effort of governments, civil societies, communities, development partners, and indeed all stakeholders to ensure that every eligible individual is reached and receives life-saving vaccines. Since 2019, the world's first malaria vaccine has been available in parts of Ghana, Kenya, and Malawi in a pilot introduction. And nearly 4 years on, more than 1.4 million children have received the vaccine across the 3 pilot countries. About 360,000 children have completed the 4-dose schedule and are considered fully vaccinated. At least 28 countries in Africa have applied to Gavi support to deploy the vaccine, and that equally demonstrates the pilot's success, the growing interest and trust of our member states in the vaccine, and their eagerness to work with us to protect their population against malaria. Ladies and gentlemen of the media, you may recall that the wild polio virus circulation was interrupted in 2020 in our region, and we celebrated that important milestone. Countries have continued to immunize children, and last year, we protected 33 million children against polio. With regard to rotavirus, the vaccination has reduced death from rotavirus diarrhea by 49%. And we are also very happy that all our governments in the African region have introduced the human papillomavirus vaccine, HPV. Ebola vaccines have been crucial in controlling recent Zaire Ebola virus outbreaks, and promising vaccines against other diseases are also in the pipeline. We have launched the mRNA Hub in South Africa to support local manufacturing of COVID-19 vaccine in Africa, as well as providing trainings in mRNA technology. As we commemorate this year's African Vaccination and World Immunization Week, allow me to echo the vision of the regional immunization agenda for the African region. I quote, "A region where everyone, everywhere, and at every age benefits from vaccines for good health and well-being." To achieve this vision, we all must deliver on our commitments to ensure universal access to immunization. Priority action in this regard include strengthening health systems, building and sustaining political and community leadership, reaching zero-dose and under-immunized children, enhancing data systems for decision-making, building resilient immunization programs, and strengthening capacity for vaccine logistics, regulation, safety monitoring, and local manufacturing. I thank you.
Thank you very much, Dr. Kabore, for that update on vaccination in Africa. And now we are turning to the Honorable Minister Dembi from Sierra Leone. Can you please tell us how Sierra Leone has managed to increase routine immunization? Honorable Minister, sir.
Thank you very much, Dr. Stevens, and thanks, Dr. Kabore, colleagues. I think it's a very important time for us to all come together and pay attention to one of the biggest investments in healthcare delivery, immunization services. We believe that you have perhaps one of the highest returns of investment by ensuring that the vaccination programs at the national level, at the regional level, at the continent-wide level is effectively implemented. I think for us in Sierra Leone, we've shown tremendous leadership through His Excellency the President, Brigadier Retired Dr. Julius Maada Bio, and he was at the Addis Ababa conference to share some of the experiences in Sierra Leone. I have to preface this by saying the impact of COVID-19 in a lot of countries around the world is country context specific. And I think for us in Sierra Leone, what we saw with the COVID response has been informed by our experience with Ebola. There are lots of things that happened in the Ebola outbreak in West Africa that we were not ready for. But I think by the end of the outbreak, we put in place systems that will allow us to detect early and respond very effectively. In Sierra Leone, we saw less than 8,000 infections. We saw about 125 deaths throughout the 2-year period. And this is not by accident. It's a deliberate action on the part of the government and the people of Sierra Leone and our development partners to have a robust response to COVID-19. But I think having said that, there are some consequences of that for our immunization program that I just want to highlight 3 specific areas that may be of interest to us all. One was the fact that we had to have restricted movement of people during the outbreaks. I think we managed that effectively on a national and a local level. The implications of that is in a lot of cases, people were not able to access the medical facilities to have their routine vaccination. At the same time, it was very difficult for the vaccine providers to actually go out and meet people in their respective sites. And so today we have, the consequence of that is today we have about close to 26,000 zero-dose children. And I'll talk to you about how we're trying to find these children and provide vaccines for them. Besides the restricted movements and the associated disruption of our vaccination programs, it also happens that we had a lot of people diverted from their routine vaccine work to focus on COVID-19 response. And that has its own implications. Thirdly, there was some myths also derived from the Ebola experience that, when these things occur, you want to shy away from hospitals. You don't want to go there. And so people stayed away from the hospitals for quite some time. And I think all of that contributed to the 26,000 zero-dose children that we have. So for us, how do we respond to that? We are committed. We believe in vaccination. We believe that Sierra Leone, as with a lot of countries in the region, should be able to focus on 0 preventable vaccine deaths in our respective countries. And we're committed to that at the political level, at a program level, at a functional level, at the population level. So what that means for us is the COVID-19 came with a lot of assets, a lot of capabilities as well. What we've done is to convert that assets into integrating into expanding our EPI programs. We are looking at integrated services now such that as we use the resources for COVID, we're using those same resources to be able to apply to our routine vaccination services. The COVID response came with additional cold chain capabilities. They came with additional resources for taking vaccine to the people. And what we're doing now, instead of taking one COVID vaccine to the people, we take all of the vaccines to the people, to the farthest reaches of the country. We employed about 1,500 data clerks. We have additional vehicles. We have solar panels to maintain cold chain. We have additional actual resources to pay the essays that will allow people to go into remote parts of the country. We're also actively looking at defaulter tracing. And what that means is we engage in the community, we engage in partners to identify missed children and actually go out and actively find them and provide them the services. We're doing periodic intensification of vaccination services in real campaigns throughout the country. We're doing ring vaccination in restricted areas where we have small cases, for example, measles outbreak. We make sure that we vaccinate a particular location and use our resources well. We're also ensuring that the government co-financing of all of our vaccination efforts is given top priority. And at this point, I really want to say a profound thanks to Gavi for the partnership and UNICEF for the partnership that we've been able to employ. During this period of austerity, during this period of very, very difficult times, we were able to introduce HPV vaccine. We set a target of vaccinating 150,000 10-year-olds in 2 weeks. 2 weeks, we vaccinated 184,000 10-year-olds. We, in the same period, were able to deploy the Ebola vaccine in response to the outbreak of Ebola in Guinea, and all of our frontline healthcare workers were protected. At the same time, we're looking at malaria vaccine. We're preparing ourselves for the next opportunity to actually vaccinate, and we've paid for about 1 million doses already that will allow us to take vaccination services outside. We're also looking at typhoid vaccine as well. So throughout all of this, we're bringing all of these assets together to build back stronger, to build back better, and ensure that there is zero preventable vaccination deaths, immunization associated deaths in Sierra Leone. I'll stop there and wait for the discussion phase. Over. Mary, I'm turning over to you.
Thank you very much. Thank you very much, Honorable Minister.
I could carry on, but
we seem to be having a small internet connection problems. Thank you very much, Honorable Minister. We'll go now to Dr. Asidu Bekwe from Ghana Health Services to give you brief remarks. Over to you, Dr. Bekwe.
Yes, thank you very much, and good morning to the panelists and all other persons on this forum. I would say that Ghana has had a very successful program over the past, I would say, 30 years. We started vaccination in 1978. Currently now, we are running 13 plus 1 antigens. I say plus 1. The plus 1 is the malaria vaccine, which is more of a pilot in for now 93 districts. We have been having relatively high coverages for our antigens using Penta-3 as a proxy. I would say that we've had a coverage from like 88 up to, I would say, like currently now around 98. We had a challenge when we had the COVID. I mean, our confirmed cases was in March of 2020. And when it occurred, there were a lot of challenges by the front of health workers and also on the part of the caregivers. Everybody was afraid about how to access care. So that led to, I would say, a reduction in service delivery access. And so the government somehow put in measures to address these challenges. For now, Ghana, I'll say we are on the low side in terms of our cases of COVID. Now we are just, for the past, I'll say 2 months, we are not recording any significant cases. But during that period of the high peak of COVID, what we tried to do was to gain the confidence of the caregivers and the community at large. So we actually engaged them. We came about development of a guideline. The guideline was how are we going to ensure that the persons who are supposed to come for vaccination were coming on board. So we tried to identify defaulter children. We will now go on to call them. We also tried to make sure that we were doing the follow-up visits. We also tried to make sure that we had regular small sessions to make sure that we get all these children. We also tried to do mop-ups for all these children that were lost. Then we tried to also identify where are the hard-to-reach areas that we need to reach these people. So Ghana has a drone system, which is a medical drone. So these areas, we had to use the drone to make sure that the vaccines were transported to these facilities. One of the things that has come as a good thing for Ghana is that COVID has brought on board a lot of infrastructure. We have done our COVID coaching equipment assessment. So the gaps have mainly been reached or addressed by this by virtue of the COVID vaccination. Now we have a lot of I would say coaching equipment. We have cold room structures being put in place. We have freezers, cold working freezers. We even have vehicles, cold vans, all to help us address the challenges of vaccination. If you look at our coverages, though there was an initial dip by way of coverages, we've somehow appeared to catch up. We, by virtue of being a lower income country, are on the acceleration phase of Gavi. So we have two ways of financing our vaccination. So there's a traditional funding, which is government is fully borne it. They have the Gavi co-financing, which we, as much as possible, we try to adhere to the set guidelines. We started our malaria vaccination a few years ago as one of the pilot countries, and I would say that we have been quite successful. If you look at the coverages for the first year, for 1, 2, 3, we are around 70%, and then for the fourth dose, we are around 50-something%. What we've tried to do is to make sure that instead of taking the fourth dose at 24, we are now bringing it to 18, which falls in line with the MR2, so that hopefully it will help us achieve the children that will be missed. Ghana fully appreciates the benefits of vaccination, and the government is fully committed to make sure that together with the partners, every child in Ghana is not left behind. Thank you very much.
Thank you very much, Dr. Asidu. Indeed, vaccination saves lives. Now we are turning to Ms. Guen from Gavi. Can you describe to us how Gavi is working with countries to raise routine vaccination levels?
Good morning and good afternoon, colleagues and friends in the media. And my very heartfelt thanks to Dr. Joseph Kaboro and to WHO Afro for the opportunity to be with you. And thank you also to my fellow panelists for their remarks. Indeed, Gavi's been very, very active. We're very, very happy to be marking in a few days the 2023 edition of the Africa Vaccination Week. And it's a really good opportunity for us to take stake and to remind ourselves of what we have achieved, but also what we are dealing with in terms of recovering from a pretty unprecedented emergency during the pandemic. And I want to start by really paying tribute to the African governments and to the healthcare workers for essentially vaccinating more people in the shortest amount of time than ever before in history. We heard from the colleagues so many priorities and demands that are being covered, that are needing to be covered, and also a real effort in terms of reducing the number of what we call the zero-dose children, the children that do not have any dose of a life-saving vaccine. We've seen some really good examples, and this is some of the work that Gavi is doing in very close partnership with countries. For example, in Chad and in Niger, we've seen the number of zero-dose children reduced by 16% and 20% respectively in 2021 amid a really, really difficult situation. And so as we think about still the ripple effects of the emergency response efforts, and the number of children and adolescent girls that are not protected with vaccines, we also need to think about outbreaks. I see a question in the chat. There have been diseases such as measles, cholera, polio that were on the decline, and as a result of the pandemic and decreased coverage are making a comeback for us to address. And so that's very much why we at Gavi, in very, very close collaboration with our alliance partners, WHO, AFRO, and the governments, including Sierra Leone and Ghana, are working hard in terms of our efforts to support countries to make up this lost ground, and also to build stronger systems that are more resilient than ever. And we heard that from the Honorable Minister from Sierra Leone. And so for us, a strong focus is around how we reach the millions of children living in the hard to reach communities, for them to get them their vaccines, how we think about the ability of the health systems with primary healthcare systems to be able to get vaccines, and how countries can help monitor and respond to outbreaks. So let me give you an example. Last week, very recently, we announced the launch of our Zero Dose Learning Hub. And so what the Zero Dose Learning Hub is, it's a new mechanism to improve how data is leveraged so that we can identify and reach the millions of children who are not receiving a single dose of vaccines. And it relies on a new network of global and national organizations, including partners in Nigeria, Mali, and Uganda, that are going to be helping share the learnings with other countries on the strategies they experiment with and that work best. We're also working with countries to implement national programs that are able to reach children in communities more effectively than ever. So one example is in Niger, where we've made a lot of progress with what we call the Kutuho campaign, where the efforts of the community health workers, the leaders, community leaders, are being put together to build awareness and increase access to life-saving vaccines in remote and rural areas. This year, and we heard about it from our colleagues, a big focus is also on the large-scale rollout of malaria vaccine. So at Gavi, we're really excited to continue our engagement with the regional and global stakeholders to support the vision of developing a successful program, and also developing sustainable African manufacturing to help with this vaccine and others. So quite a lot of work still to be done. During the pandemic, one of the hardest hit vaccine programs was on human papillomavirus vaccines. Many adolescent girls missed out. And cervical cancer is the most common cause of female cancer death in nearly half of sub-Saharan African countries. And it is one of the most effective vaccines that we have. The HPV vaccine can prevent up to 90% of cervical cancer cases. So this is a vaccine program for us that's really critical from a public health perspective, from a gender equity perspective. Gavi has supported 20 African countries to introduce the HPV vaccines. We've building on this with extra efforts. We've approved late last year $600 million to revitalize our program. And this extra investment is going to go in strengthening the health systems, making sure the technical and the learning support the countries need are provided so we can reach more adolescent girls. And we also want to make sure that we're looking at the very context-specific challenges that countries across Africa are facing. So, for example, communities living in fragile and conflict settings where there's little access to primary healthcare services. This is where civil society comes in very strongly, engaging with communities. Women is another topic in terms of the role that women play in protecting health and well-being of children. And many studies have showed the direct correlation between immunization and women's empowerment. So for us, it's really important that women are able to make decisions about their family's health and household finances, such that there is a higher likelihood that their children will be vaccinated. And therefore, we're working on gender-related barriers that very often prevent children from receiving immunization, but also other health services, and making sure we put women at the heart of our collective effort to get immunization back on track. So as we think about many, many challenges ahead, we also are considering the opportunities, and we have a young and growing population. And so it's really our responsibility and opportunity to make sure that we don't leave any child behind with immunization. Thank you, Mary, back to you.
Thank you very much, Ms. Guen, and thanks to Gavi for all your support to our countries in Africa. And now turning to you, Professor Ampofo. Can you briefly tell us about how Ghana is maintaining its supply of vaccines?
Thank you very much for that question. I think our colleague from vaccine manufacturing in Africa. And we in Ghana are very tip of the president of Ghana. We started a vaccine, the enabling environment, and came up with a roadmap. And this roadmap set out the process to establish a legal framework for this in Ghana. Through our Ministry of Health, we've developed a policy for vaccine manufacturing and development in Ghana. This policy has been approved and adopted by the highest level of government. We also then set out to develop a National Vaccine Institute bill, and this has been processed by the Parliament of Ghana and has been adopted as a law. It has been passed as a law, and this has been assented by His Excellency the President. Now, what does this National Vaccine Institute set out to do? It sets out to coordinate the development and manufacturing of vaccines in Ghana. The pillars of our roadmap for vaccine manufacturing and development in Ghana are: one, to facilitate the private sector to be the actual manufacturers of a vaccine. Number two, to enhance the ability of our regulator, the Food and Drugs Authority, to be able to do vaccine lot release for products made in Ghana. The other thing is to enable research and development by academia and research institutions to provide, the necessary R&D that will feed vaccine development in Ghana. And then fourthly is to look at the partnerships for tech transfer, for human capacity development, and the full spectrum of resources that will enable vaccine manufacturing to proceed in Ghana, including, of course, market shaping and looking at the sustainability, because eventually we hope that our vaccine program will be able to provide the products for our EPI program. We'll be able to provide products that for pandemics and outbreaks. So in a nutshell, this is what we're doing in Ghana. And just this week, and this is the African Vaccine Week, our president did a groundbreaking for the DEK Vaccines Limited. And this was a very big milestone for us in Ghana. Last year, also under what we call the One District, One Factory program supported by government, another company also established a factory to produce related pharmaceuticals and vaccines in Ghana. So we have two companies that government is supporting, and we are trying to create the enabling environment that will make these factories produce vaccines that will feed into our national program. So we have a big target for self-sufficiency. We're working and talking with African Vaccine Partnership for Vaccine Manufacturing at the Africa CDC. We've been talking to Gavi, and we're making sure that our program is in line with the continental objectives for making vaccine manufacturing in Africa. So yes, vaccine self-sufficiency, we know this is a challenging process. We know it's not going to happen overnight. We are looking at all the possibilities. We have a great partnership with the EU, and with various other partners. And we're very grateful for the steps that we have happened so far to enable us colleagues in Africa. Thank you.
Thank you very much, Professor Ampofo. Indeed, we have learned a lot from the COVID-19 pandemic. the challenges we have had with our vaccinations. And now we are using the experience to ramp up capacities across Africa. Thanks to Ghana and Sierra Leone for sharing your experiences. We believe this experience could also benefit other countries across the continent. So now turning to you journalists, you have heard from all our panelists. It is your time to ask your questions. And to do this, please use the Q&A function on the Zoom platform. Tell us your name and the name of the media organization you represent. If you want to go live, please indicate in the Zoom Q&A as well. To answer your additional questions, we have experts from WHO Afro that are on hand to help you. And these are Dr. Ado Boaka. He's the acting team lead for Vaccine Preventable Disease Program. And then we have Dr. Jamal Ahmed, the coordinator for polio. We have Dr. Fiona Atuhebe. She is the new vaccine introduction officer. We have Dr. Patrick Otim, health emergency officer. And we have Dr. Dorothy Achu, team lead for tropical and vector-borne diseases. We have Dr. Fiona Braka, who is the team lead for emergency response. Okay, so while we wait for the live question, I'm going to read out one of the questions that we received. This question is from Rhoda from BBC Africa. Nigeria and Ghana have approved the use of the R21 malaria vaccine before the FDA and WHO approval. Despite these being sovereign decisions made by countries due to the burden of malaria there, what does the WHO make of this move? Can I start with Dr. Fiona, please, Atuhube?
Thank you very much, Mary. And it is indeed not unexpected that national regulatory authorities would authorize products for use in their own jurisdictions. WHO has the global mandate to review vaccine and medicines for global recommendations and has established processes to assure vaccine safety, efficacy, quality, and programmatic suitability, especially in low and middle-income countries. And it's a priority right now for WHO to continue this thorough and efficient review of the second malaria vaccine, which is the R21. The review of the initial data from the ongoing phase 3 trials of this vaccine is underway. And this is being supported by independent global advisory group of immunization and malaria and regulatory product evaluation experts. WHO also looks forward to learning more and understanding more fully the R21 vaccine performance once additional key safety and efficacy data from phase 3 trials is available to us. And again, as I mentioned, we are already evaluating the safety and efficacy and the quality and the suitability programmatically for this vaccine. Ghana and Nigeria have not jumped the gun because it is expected that at national level, within their jurisdiction, the national regulatory authorities can take this forward also and review this data once they have received information from different vaccine developers. They have systems in place which sit down and also review this data and can grant that approval. However, we need for UNICEF to go ahead and procure this vaccine, which is done in most of our low and middle income countries, for Gavi to also go ahead and fund this vaccine. A WHO pre-qualification is required. Thank you, and over to you, Mary.
Thank you very much, Dr. Fiona. Dr. Asidu, do you want to weigh in on this from the Ghana perspective?
Okay, thank you very much. So I think that from the front of Ghana, so the FDA has actually given the approval. The process is that it goes to the minister. The minister is now going to refer it to the NITAC, that's the National Immunization Technical Advisory Group, who review the data and then the science behind the approval. And then based on that, it will now be recommended for use by the service. So I think that for now, it's early days yet for us to fully use it. But I will say that Ghana we are privileged to be part of the pilot countries during the RTSS. So there's still room if you get more vaccines that have been that are approved. Is good for us. But for now, it's early days yet. Thank you very much.
I would like to add something else too.
Yes, Prof.
Yes, and for us in the Presidential Vaccine Committee, the R21 news is actually very heartwarming. As part of the engagement we've been doing to facilitate vaccine manufacturing in Ghana, we've actually facilitated partnerships between DEK manufacturing, DEK vaccines, and the Serum Institute. And the R21 application was actually by the Serum Institute to Ghana's FDA. And Serum Institute is actually in Ghana holding talks with the DEK Vaccines Limited, forging, future collaborations, looking at how R21 could be, fill finished and produced in Ghana going forward. So we are very happy that the African Vaccine Week is seeing such positive discussions between partners. We all know the key role that the Serum Institute made in producing the COVID vaccine, which was used globally and in many parts of Africa, including Ghana. And we are very happy that our vaccine program is actually benefiting from partnerships by the government of Ghana, and that includes, independent work by our regulators and also very important interventions by our scientists who are looking at how, malaria vaccines could be developed and used alongside in the programs in Ghana. We're very happy with these new developments. Over.
Thank you very much, Professor Ampofo. And now to you, Honorable Minister. Then be pleased.
Thank you very much, Mary. Again, I think we were all very impressed by the speed which the R21 has been brought to the fore. Again, I think in Sierra Leone's perspective, I'm sure it's the same in multiple countries. These are not full approvals, these are tentative approvals as we allow to get additional data and better understanding of the vaccines. I think we have a huge burden of disease here, and it's something that really impacts us as nations. And if we see an opportunity for a product that's going to be life-changing for us, we want to be a part of the solution. We want to be able to help generate the data quickly to have it not just tentatively approved, but formally approved for use. Over.
Okay, thank you very much, Honorable Minister, for that addition. So this next question is coming back to the Ghana team. I will start with Professor Ampofo. This is from Alex from Reuters. Will the approval of the R21 malaria vaccine speed up getting malaria vaccines to Ghana? And if so, how? Has Ghana placed any orders for the vaccine yet? Or has it secured financial support commitments from the likes of Gavi or development partners? Let's start with you, Professor.
Order to ask is like it's quite in order to ask this question. As Frank we will look and look at the needs that the NITAG and the EPI program will draw up using our ongoing experience with RTSS pilot implementation. So there are issues that come and with history agents of look at the
Okay, thank you, Professor. We seem to be losing you. Dr. Asidu, please, do you want to weigh in on this question?
Thank you very much. So I think that my answer somehow ties in with what I said earlier. Ghana appreciates the fact of approval of this new vaccine. But as I said, there's a process by which we would have to go through before we fully start having the vaccine for use in Ghana. So for now, it's go to the NITAC, and after the final approval for NITAC, then to come to I'll say the service. So we are yet to go to NITAC for it to go to the minister and then to go to the higher authority before we can be using it in the country.
Okay, thank you very much, Dr. Asidu. Paul, I understand you want to ask your question live. Are you ready? Paul Adepoju. Paul, are you there? Okay.
Yep.
If Paul
Yeah,
is not there.
Thank you very much.
Okay.
So a quick follow-up for the Ghana team. I'd like to understand why the team did not wait for the WHO's tentative approval before going forward with these agreements. And for Gavi, I would like to know the broader, longer-term plan, considering the rapidly expanding collection of vaccines available for African countries. What is your guidance? How are you planning to adapt and in real time adjust to the needs and availability of vaccines? Because I remember Gavi director a few months ago said there has been a great demand for the RTSS vaccine among African countries, such that the manufacturer cannot even keep up with the demand. Now we are seeing countries too shifting to R21. So what is your broader plan in adjusting to these real-time changes? Thank you very much.
Thank you, Paul. Dr. Asidu, let's have you answer Paul's first part of question, and we have Ms. Guen to answer the second part.
Yes, thank you very much. So I think the Ghana FDA is one of the reputable FDAs globally. So based on the evidence that they have, I think they are in the right position to say that we give approval. And I think, as I'm saying, there's still a process that needs to be gone through. So after they have actually given approval, we have this international, this group of scientists who look at the data and say that, yes, though the WHO has not pre-qualified, we think that it's good for use. And let me say that Ghana, we have 93 districts that are now using the RTSS. There are a number of districts that are yet to be using it. So if we have another vaccine, which is good, I think nothing stops us from using it. Thank you.
Can I make an addition, please?
Go ahead, Paul.
Yes, I would like to remind our colleague from Nigeria that it is Ghana and Nigeria regulatory authorities who have approved the R21 vaccine. And the R21 vaccine was approved based on the application by the manufacturer Serum Institute. So it was not an independent decision by the Ghana FDA. It was in response to the application by the Serum Institute for the R21 based on the data that had been accumulated. Over.
Thank you very much for that addition, Professor Ampofo. So we are going to the next question. This question is from Delphine.
Sorry, could I come in on the Gavi questions, please, for the previous question? Thank you very much. So just to answer the questions from a Gavi perspective, and to say that very much from we are ready to provide funding for R21 as it's undergoing the process in terms of review of the trial data to be able to have a SAGE evaluation and a WHO pre-qualification. But for us, this is a hugely exciting development. I think with the approvals that we've seen in Ghana and Nigeria, this is all moving us forward towards having a second vaccine. And it's really important for us to have these several tools. As was alluded to, at the moment, we have restricted supply of the current vaccine being used in the 3 pilot countries. We have 18 million doses of the RTSS vaccine available for 2023. We have 14 countries already approved for Gavi funding support. We have many more that are interested. And so we're doing a very careful balancing right now in terms of making sure that with the availability that we have of the RTSS vaccine, we match it to where there is the greatest need, also using the principle of solidarity so that countries can use the existing supply. But in the longer term, it's very welcome. Any vaccine market, and particularly this one, needs to have several products and scaling up quickly. It'll also be, I think, very important that it's not just about the volumes, it's also about the affordability. SII has made a very important public commitment in terms of keeping the cost of the vaccines to $3 or less. So we really look forward to them honoring that commitment, because ultimately it will mean that more people are protected. Thanks.
Thank you very much, Ms. Guyen, for that reassurance of Gavi support for the malaria vaccine. Now we are going to take live question from Nicholas from CGTN. Nicholas, are you ready?
Yes, I'm ready. Can you hear me?
Yes, go ahead, please.
So the question is about the WHO teams in Sudan, the current situation. How are the teams in Sudan, and what's being done to the current situation going on in Sudan currently? Thank you.
Thank you, Nicholas. Dr. Patrick Otim, do you want to respond to this question? What is WHO doing currently in Sudan?
Thank you very much. I think just from the onset to clarify that Sudan, which is one of the countries on our continent, but falls under the Eastern Mediterranean region of WHO, but we are in contact with our colleagues in Cairo, who coordinates the Eastern Mediterranean Regional Office, and also the country office in Khartoum. Colleagues have been working, as you noticed, because of the conflict that has been going on within Khartoum. A number of people have been reported dead, and also the casualty is very, very high. So the primary focus has been in supporting the health facilities to be able to offer primary trauma care. And the WHO team in Sudan have been supporting the hospitals through provision of trauma kits that are very critical in supporting the hospitals to be able to provide surgical care to those that are injured. And also, I think the other one has been supporting the medical association in Sudan to be able to work with the different entities and preposition supplies in the places where active conflict is happening, but also ensure that healthcare workers are able to access health facilities where they can provide care. So it is a situation that is evolving, but I think as we get more information from our counterparts in Sudan and in EMRO, we'll be able to share with journalists. Thank you.
Thank you very much, Dr. Otim. Dr. Kabore, do you want to weigh in on the Sudan case?
Okay, thank you. Thank you very much, Mary. Yes, the situation in the Republic of Sudan is deeply concerning. We know that hundreds of people are killed, including health workers, and we have several hospitals that are closed due to attacks. And the country is also experiencing shortages of blood, transfusion equipment, intravenous fluid, etc. And as WHO, I think the DG already said it, we strongly condemn these reported attacks on health personnel and health facilities and ambulances. Health care facilities and workers must never be a target, especially when thousands of civilians need access to emergency care. I think our colleagues already explained what we are doing there in Sudan, but I also wanted to add that in some neighboring countries like Chad, which is one of our region country, since the beginning of this conflict, Chad has received between 10,000 and 20,000 refugees from South Sudan, which needs support from WHO and other partners, UN agencies, to support these refugees that are coming from Sudan to the neighboring countries. So I just wanted to add that. Thank you very much, Mary.
Thank you very much, Dr. Kabore. Now we are going to the next written question. And this question is coming from Delphine Chayet from Le Figaro. Can you give an update on the cases of Marburg fever? Are you worried? Is there enough follow-up in the countries that are concerned? Has there already been a vaccine? Dr. Patrick Otim, please.
Thank you, Mary, and thanks to the colleague for the question. Marburg, as we know, is one of the filoviruses, and Marburg virus disease outbreak is an outbreak of concern. Currently, within our region, we have 2 countries that have active outbreaks. So I'll go through them. The first one is the Equatorial Guinea, where the first case was reported on the 13th of February. And so far, we have outbreaks in 4 provinces. It really started in the province of Ebebeyin and in Sok, but then we have had cases in Evinayong province, and then the last few weeks the transmission has concentrated in the west of the country, in the Bata province. So far we have 13 confirmed cases that have been reported, with the last confirmed case on the 17th of April. And we have 11 deaths among these confirmed cases. Unfortunately, we have had 5 healthcare worker infections, and 2 of these healthcare workers have died. So this is the situation currently in Equatorial Guinea. In terms of the follow-up, so the Ministry of Health and the government of Guinea have really mounted a very robust response. And as you notice, from the 13th of February up to now, where we have the outbreak going, though the geographical spread has increased from 1 province to 4, but the number of cases has remained low because of the measures that the government with support from partners has been able to implement. And the contact tracing has been going on. As of yesterday, they have 329 contacts that they are following, and the contact follow-up rate is good, around 80%, 292 contacts that were seen yesterday. So the response is continuous within the country, and currently I think there's only 2 cases that are being managed at the Modong treatment facility, and we had 3 that have recovered, who have been managed by the very brave healthcare workers that are providing treatment in Equatorial Guinea. For now, the discussions on the vaccines have been ongoing. We have not yet had a vaccine being deployed yet. We know there are 2 candidate vaccines, but engagements between our colleagues that are in the research and development team and the government and regulators in Equatorial Guinea are ongoing. We hope when there's progress, we can be able to inform on that. Then the second country is Tanzania, and Tanzania reported their outbreak on the 27th of February in the Kagera region. And so far, we have had 9 cases. And of these 9 cases, we have had 6 deaths. And these cases are really confined to Bukoba District Council within the Kagera region. And actually, out of the 9 cases, 6 are family members. So they are related, and 2 of them are healthcare workers who provided care for these family members. And currently in Tanzania, we only have 3 contacts that are being followed up. And the last confirmed case was a known contact and was already on the list and had been quarantined and was being followed up. So we didn't have many contacts arising from that case. That was also the same case in Equatorial Guinea. The last case was a healthcare worker, was also a contact and had already been quarantined, and there were many contacts generated from that. So overall, we'll say that we have low intensity transmission in both countries, and the responses by the 2 governments in Equatorial Guinea and Tanzania have been very comprehensive up to this point, and we really want to appreciate that. Now, I must add that viral hemorrhagic fever outbreaks are very challenging to deal with, and we must never lay down our guard. So the efforts have to continue until the end of outbreak declaration is done. So we encourage the population in the two countries to continue to comply and cooperate with the responses that like they have been doing in the last few weeks, and also the government to sustain the interventions that they are put in place up to when we can be able to declare the end of the outbreak. Thank you.
Thank you very much, Dr. Patrick Otim. And this next question is coming to Dr. Ado, and I would like the Honorable Minister to weigh in as well.
Mary, if I could chime in.
Yes, please, go ahead, Honorable Minister.
Thank you very much for the response on Marburg, and it's really good that Equatorial Guinea and Tanzania are putting forward a very robust response. I think my plea to WHO and to everybody on this panel is we have to figure out a way to not chase the virus, but to actually be ahead of the virus. In Sierra Leone, we've isolated 3 different isolates of Marburg in the wild, in wild bats in Sierra Leone, in 3 districts in the country. So we know that the virus is existing here. We know that it's in a bat species. It's only an index of time before the virus jumps species and enters into the human population. I think it's an opportunity for us to really be ahead of the virus by active surveillance and readiness. And my plea to WHO is to help Sierra Leone in this quest of preparedness, to see that if we do see this virus jump species, that we're able to adequately respond quickly and be able to save not only Sierra Leone, but save the continent as a whole. Thank you.
Thank you, Honorable Minister. Indeed, this is a very, very useful information. And I would like to assure you that WHO is ready to support Sierra Leone to enhance your readiness capacities for Marburg, just as we are supporting the other countries surrounding Equatorial Guinea and Tanzania. So our teams will follow up with your team on ground in Sierra Leone. So this next question is coming to Dr. Ado. The question is from Solange Ablan from Radio National Catholic in Cote d'Ivoire. And I would like Honorable Minister to also weigh in on this question. We are in the World Immunization Vaccination Week. Which actions should be taken to make vaccines accessible to all if they are necessary for health? Let's start with you, Dr. Ado, and then the Honorable Minister will weigh on it as well.
Yeah, thank you, Mary, and thank you for the question. Indeed, we are in the World Immunization Week, starting from 24th of April. And we in Africa, we are also going to celebrate the Africa Vaccination Week next week. Countries are put in place activities that they are going to implement to make sure that not only advocacy is conducted and populations are sensitized on the importance of vaccination, but also carry out activities to make sure that the vaccines are made available to health facilities and to other places for children and women and other adults to get these vaccines. Some of the activities are like getting to outreach places and make vaccines available to this population that are out to reach. And some activities will also include doing some kind of little campaigns around places where unimmunized children or zero-dose children are identified with the community. Some countries that are conducting some campaigns, preventive or reactive campaigns, will also use these opportunities to make sure that the vaccines are taken to very hard to reach places so that people could get these vaccines as needed. Thank you.
Mary, I think your microphone is off.
Okay, Honorable Minister, thank you, Dr. Ado, for this information on what we can do this week. If you can weigh in from the country perspective, please.
Thank you very much, Mary. I think for us in Sierra Leone, we joined the world community in celebrating Vaccination Week. I think for us, we're also looking at it slightly differently. We're looking at vaccination not as an entity that's a standalone. We're looking at vaccination through life stages. Starting from the pregnant woman to the baby, to the school age, to adults, to senior citizens. We're looking at it also through a gender lens. And for us, there's some deliberacy around it to make sure that no one is left behind. So as we focus on vaccination, routine vaccination for infants, we're also looking at what is the focus for 10-year-olds with the HPV vaccine? What's the focus for adults? What's the focus for senior citizens where the focus is really on COVID-19 availability, accessibility, and delivery? So we want to be able to make sure that nobody is left behind, and as a deliberate effort, look at it through different life stages and apply vaccination efforts in each of these life stages. We're looking at integration of services as well and see how could you, if you have an opportunity for one vaccine, put all of the other vaccines together that are directed at that particular population. We have some remote areas, especially riverine areas, that are very difficult to access. If you have this access to them maybe once or twice or 3 times, how do you make sure you have a whole arsenal of vaccines available as you deliver it to those very remote, hard to reach places? So we're excited about the Immunization Week, and we want to take that opportunity to highlight our approach using life stages.
Thank you very much, Honorable Minister. And this question is coming to you, Dr. Kabore. The question is from Edward Samuel from Voice of Nigeria. Samuel is asking, what are the achievements in the African region on immunization? And then Honorable Minister can also tell us the achievement in Sierra Leone as well. Dr. Kabore?
Okay, thank you very much. I think this is a very important question. As I said in the beginning, our countries have really made tremendous progress in terms of coverage, vaccination coverage in our countries for children, but also for women. And WHO Afro provided support to countries in terms of providing technical support, in terms of guidance, technical guidance, tools, so that they could really implement the activities in countries. In terms of achievement, we have really several countries that have reached the coverage, but we still have some countries that are lagging behind. We have identified these priority countries where we are really providing focused support so that they can really make progress. In the East and Southern Africa region, for instance, we have, I think, 6 countries where we are really providing targeted support. In Central Africa, we also have some countries where we are providing the same support. But in terms of direct support to these countries, the focus is really to reach first the past cohort of 0-dose children. This is extremely important. The minister already said it, and the DG of Ghana also said it. COVID had a very negative impact on our immunization programs. So the achievement now is really to provide the support to the countries so that we can reach the past cohort of 0-dose children in the country. The second is to provide support to countries to increase the coverages, because we have several that are still below the coverage needed to protect children and women. The third one, in terms of achievement, is about building our immunization program, but using primary health care as the foundation and really integrating these programs in the health system. The Minister of Health, Sierra Leone, already said it. So we don't want to continue to support the immunization program in a very vertical manner, but in a very integrated process, having communities and primary health care as the foundation to really support this program. So these are the support really provided by the regional office of WHO to countries so that we can transform the disruption caused by COVID to a more successful program using the assets and lessons learned from COVID. So over, back to you, please.
Thank you very much, Dr. Kabore. The Honorable Minister, please, achievements from side of Sierra Leone.
I think I have just 2 quick points to make there. First, we're looking at vaccine coverage, which has expanded tremendously. But I think for us, what we're looking at, some of these targets that we set out to accomplish should be floors rather than ceilings. So we really want to expand the coverage and get to a point where we have every and anybody that needs to be vaccinated has access to those vaccines. And so there's a deliberate effort with that. And so we're looking at expanding it. For 0-dose children, right now we have an estimate of about 26,000 0-dose. And I think for me, it's nice to have a quantity to work towards. We're going to have some deliberacy around achieving coverage for all of those 26,000 in the shortest period of time. And the fact that we have this target set, we're able to evaluate progress towards that target on a weekly basis, on a monthly basis. How far are we going towards achieving all of those 26,000? So for me, the one issue is expanding coverage and ensuring that no one is left behind. The second component is ensuring that we also expand the number of vaccines, number of antigens that are available. We're all excited about the news about the malaria vaccine. And so we'll do everything we can within the limits of science to be able to make those vaccines available as quickly. I mean, if it means getting actively involved in its evaluation, I think we will be more than happy to be a part of such a story. I mean, they're often vaccines that we're struggling with. The Lassa fever vaccine, you know, it's been developed over the past 20 years, but it looks like it's not getting the kind of attention that it requires for people who have several thousand cases of Lassa fever on a regular basis. The Ebola vaccine, I mean, I think we have some really good candidate vaccines now that we should be able to make available. If you're working on Ebola vaccines, the filovirus vaccines family in general, we shouldn't really be thinking about a vaccine for Ebola, a vaccine for Marburg. They belong to a very common family that if we look at some solutions, some common antigen that would reflect both of, I mean, these major filoviruses, that we could have some solutions around it. So I'm looking at expanding coverage using primary healthcare system as the base, using the life stages approach. Secondly, bringing in new antigens and expanding our ability to cover these new antigens within our population. We're working on that in Sierra Leone, and all the help that we could get in terms of financial, material, knowledge sharing, experience sharing, I think will be critical not only for Sierra Leone, but the continent as a whole. Thank you.
Thank you very much, Honorable Minister. We are now coming to the end of the briefing for today. We will turn back to our panelists to give us their final messages. Dr. Asidu, I'm starting with you, and in your final message, I would like you to also mention some of the achievements from Ghana and give us your final message, and then we go to Professor Ampofo, and then Ms. Nguyen, Honorable Minister, then Dr. Kabore. Dr. Asidu, please.
Yes, thank you very much. Let me say that Ghana has appreciated the use of vaccines over the period. We have never recorded any wild polio since 2008. We've never recorded any MNA since 2012, since we introduced it in our routine vaccination. There's no record of any confirmed measles death since 2008. So clearly, you can see that there are obvious gains for the country by virtue of our high coverages. We want to use this opportunity to thank all our partners, Gavi, WHO, CDC, UNICEF, for the support they've given to the country, and also the central government. We want to thank all of you for the best effort you're doing to Ghana so far. And let me say that we appreciate the new approval on the new malaria vaccine. Ghana is moving to elimination of malaria, and we think that when we have new vaccines, it's going to help us achieve that in the near future. Thank you very much.
Thank you very much, Dr. Asidu, and thanks for sharing the achievement from Ghana. Professor Ampofo, your final message, please. Okay, so let me go to Ms. Nguyen. I'll come back to Prof. Ms. Nguyen, please, your final message.
Thank you. I want to appreciate the opportunity to join you today, and thank you from all the media folks for your questions. For me, it's really about routine immunization recovery and reaching zero-dose children as a major priority for Gavi and all our partners. In terms of achievements, Gavi has reached more than 400 million children in Africa with immunization services. If you take our vaccine, which is what we call DTP, diphtheria, tetanus, and pertussis, we've reached a coverage of 73% in Africa. But we are recovering from COVID, and it did drive really important declines in routine immunization. So for us, our core mission is as important as ever. It's to maintain, to restore and strengthen routine immunization across all the Gavi-supported countries, and to focus particularly on reaching the zero-dose children. So we're making targeted investments, working really closely with countries, and we're going to be implementing a lot of efforts to try to drive down that number of zero-dose children. Thank you.
Thank you very much, Ms. Nguyen. Honorable Minister, sir. Your microphone is muted, sir. Honorable Minister.
Sorry about that. Again, I think I really want to thank WHO for the opportunity and thank the journalists for being partners in this effort. I think for Sierra Leone, we're looking at health in general, not as an end in itself, but part of the deliberate agenda of the government of human capacity development. And if that's the case, health being one of the major pillars, vaccination is an integral foundational work that we need to focus on. So for us, we don't want to have a close-ended single activity. We're looking at creating the system and supporting the system, strengthening primary health care, and ensuring that primary health care is the vehicle that we're using to ensure that vaccine efforts reach the targeted population. And I think we're not going to relent until everybody and anybody who needs a vaccine gets it. And I agree with Gavi that the zero-dose population should be deliberately targeted. But I want to assure Gavi and all our partners that even as we support the effort around zero-dose as a targeted group, we don't want to do that at the expense of everything else. So we'll make sure that the numeracy, the data, the numbers guide us to ensure that no one is left behind. And I think right now we have DTP coverage about 92%, DPP3 about 90%, with HPV1 about 91%. Again, we're seeing those as floors, not ceilings, and we really want to raise those bars as high as possible. I mean, for example, with the HPV vaccine, we're not looking at it as vaccination as an end in itself. It is part of a deliberate strategy to eliminate cervical cancer in Sierra Leone. by using vaccination as a firewall for 10-year-olds, looking at early detection and early treatment. So again, it's a really exciting time for us. We all look forward to working with everybody to support our vaccination efforts, because it's our insurance for primary healthcare. It's our insurance for human capital development going forward. Thank you.
Thank you very much, Honorable Minister. And then lastly to you, Dr. Kabore.
Okay, thank you very much, Mary. I think first of all, I really want to thank again our distinguished guests, the journalists and all colleagues who participated in this media briefing. And second, the minister said it at the beginning, we believe in vaccination. We believe in immunization as a powerful tool for life-saving. And I think that's extremely important. Thirdly, we shared the information regarding the achievement in our region, starting with on polio, the result we have now on polio, and also introducing new vaccines for hemorrhagic fevers, malaria, now and several others. So I think these are really great achievements, and even in the HPV. So that's the way we really need to continue. Yes, COVID-19 had a negative impact on our programs, and we also said that we need to use the lesson learned, the assets, to really strengthen our immunization and vaccination program. That's extremely important. Thirdly, how do we make sure that we can reach the most vulnerable people? So not in a vertical manner, but in a very integrated manner, using data. I think that's extremely important, and also innovation. Innovation can be used to really do better in our countries. I think this week is an opportunity altogether to continue to raise awareness. As I said, the head of states and government and partners met in Addis and took very strong commitment. We need to continue to build on that very high level leadership by member states. And I thank everybody really for joining this briefing session of today. There are achievements, but we believe we can do more. Thank you very much.
Thank you very much, Dr. Kabore, and thanks to all of you, our panelists, thanks to the journalists, and thanks to interpreters and everyone that has joined us today. I wish you all a happy African Vaccination Week, as well as wish our Muslim sisters and brothers happy Eid celebrations. Thank you and have a nice day.